preventive measures for Bordetella pertussis disease. The most recent advent of the vaccine therapy in allopathy medicine has reduced the chances of various infectious diseases, and it is a very remarkable victory of the medical science. The actual philosophy of the vaccine is to boost up the immune system of the human body. This pertussis disease is only found in human body, not in other animals or biological creatures. So there are two types of vaccine: whole cell pertussis vaccine (DPT), which is a combination of three diseases: diphtheria, tetanus, and whooping cough. These vaccines in the babies are given at the age of 2 months, 4 months, 6 months, and the booster dose is given at the age of 5 years, and even later on in the life, every 5-year interval, we have to boost up the immunity by giving vaccination after 5 years, booster dose. All the genders at any age, from infancy, teenage, elders one, should be vaccinated by this vaccine against the pertussis disease. Other type is acellular pertussis disease. Now the preventive measure is the simple one, that is to adopt the hygienic measures just against influenza or common colds. Then the patient must be isolated. He must be educated that he should not cough, spit, or blow his nose without tissue papers, and the other attendants or the medical healthcare providers staff should adopt the social distance of 2 meters, and they must also wear, along with the patient, mask and the gloves, because in addition to the droplet infection spread, it is also spread when a healthy person touches the fomites, that is all the articles used by the patient in his room, bed sheet, towel, utensils, all the articles, even if you touch the patient mobile, if there are living bacteria is present, you will get contaminated, and then you rub these fingers to the eyes or to approach into the mouth or the nose, and these bacteria get entry in the body and produces the infection. So this is the basic principles of hygiene. The environment must be disinfected. All the members must be vaccinated. Dehydration must be avoided by the supply of abundant pasteurized water to the patient.